What's up guys, Dr. Hunt. Today I'm going to show you how you can treat your knee pain with a wooden spoon. So if you think about it, it makes sense. When I dry needle patients, a lot of times around the knee, it's almost like the tissue is just really dense and thick. Just think of all the countless times throughout your life you flex and extend your knee, and so just little bits of fibrotic material, just little injuries just pile up over the years. And essentially the quad muscles, the muscles of the upper leg, they converge to form a common tendon that goes over the kneecap. And so tightness in that muscle group can cause tracking issues at that patellofemoral joint. And so you can have knee pain due to adhesions and tightness in the quad muscles. So we're going to go over how at home you can kind of help eliminate that. So get you a wooden spoon. This one's super cheap. It's already got a crack in it, but that's okay because we're not going to use the spoon part. So just take you some lotion. We'll start with that. And take the rounded handle part and just work the muscle tissue. So this muscle right here is called the VMO. I would start there and just use some good pressure. Take it to where it's a little uncomfortable. A lot of times you'll feel crunching in there, just little bits of adhesions breaking up. And this doesn't feel great, but if you do this for a few minutes, it'll really help with your knee pain that you're having. So you can kind of probably see it bouncing in there a little bit. Okay, so how do you know when you're done? A lot of times you'll start getting redness. That's a histamine response, blood flow to the area, and that's probably a good indicator that you're good. So do a couple more passes. Yeah, that's really crunchy in there. And that doesn't feel great, but I know it's going to be worth it. I've had a lot of injuries in this knee, surgery, and so you can kind of see how that's gotten red right there. So anyway, then you can go up and work the other quadriceps, like the rectus femoris, vastus lateralis. And just spend a few minutes a day doing this with your wooden spoon. So they make these tools called Graston tools, and they're really cool looking. They're surgical stainless steel, and they come in all shapes and sizes, but they're hundreds and hundreds of dollars. And so I love using things like this because it probably works just as good. And everybody's got one of these at home, so don't go out and buy any special tools. Try your wooden spoon first. Vastus lateralis is tight, and you can kind of see that redness there, and it does feel crunchy in there. If you find one of those little areas of crunchiness, it's okay to just kind of stay there for a few moments, like right in there, that rectus femoris. You can feel that tissue popping a little bit, and right in there, and that's a little tender right there. So spend a few minutes each day doing that, especially if you're having some knee pain, and you can see that redness right there. Okay, so now that you've worked the quadriceps muscle with your wooden spoon, I'm going to show you an amazing exercise you can do with your leg up on a table or bench or something like that. So check this out. Okay guys, so now that you've used your spoon to break up some of those adhesions and trigger points in the quadricep muscle, try this stretch to perform afterwards to help maintain that newfound flexibility. So I think it's useful to find something to rest your foot up on like this. Okay, allow this knee to kind of sink down towards the floor like you're trying to straighten out this leg right here. Sometimes it's useful, the opposite knee, let it bend a little bit, but then just lean backwards like that. Okay, if you need to support yourself with your hands like that, that's fine, or you can just lean backwards and sit down into it, and you'll feel a really good stretch in the quadricep as well as the hip flexors. So like any stretch we do, hold this 30 to 60 seconds. Demonstrate on the other side. Okay. Lean backwards, support yourself if you need to. And hold that 30 to 60 seconds. All right guys, we appreciate your time today. Hope you like this video. If you do, please subscribe to our channel. We appreciate your support, and we'll see you next time. Thank you.